repeat scans.
So, and as far
So it
as
depends upon the patient.
there was actually an article in the paper a couple of weeks ago that said, "Oh, you're exposing people to too much radiation with a test like this." What are your thoughts on
Well,
something?
you know, it's kind of interesting. If just sitting here in the Dallas-Fort Worth Metroplex, just in any given year, from background radiation from the sun, isotopes that are all around us, just everyday life, we're going to get 3 millisieverts, as we call it, worth of radiation,
Okay.
doing nothing at all. When we do these scans, we're going to get roughly maybe 9 to 12, okay? But interestingly, when we look at other techniques to understand the heart and get an idea what's going on, with like stress testing, we can give up to 30 millisieverts.
Like nuclear stress test.
Nuclear stress testing. Right. If we do a heart catheterization, we're going to get the same amount of radiation, but dramatically less information.
Got it.
And so, vis-a-vis the fact that this is a condition that kills half of us, there is radiation exposure, but the risk of that radiation is so minuscule versus dramatic information to help us to understand whether you got the disease or not and detect it early. So we also get functional information here. We can take all this data, because we get not just 3-dimensional data, but actually 4-dimensional data. And here what I'm doing is I'm cutting the heart up into 4 different slices, and we can watch the heart beat inside the chest. So we can look at all the walls of the heart. We can look at the left ventricle. This is the mitral valve here. We can enlarge any of these. This is the mitral valve, one of the heart valves. We can watch that open and close. We can make sure that there's been no heart attack or heart damage. I can look around the heart, make sure there's no inflammation around the heart or in the pericardium. This view here shows us the aortic valve opening and closing, so it's all dynamic. This view here, what we're looking at is we can literally take the heart like a loaf of bread, and I'm chopping the heart up. This is the very tip of the heart. This is the left ventricle here, the right ventricle here, and I'm basically chopping the heart up like a loaf of bread so we can look at all the different parts of the heart muscle to make sure there's no evidence of any heart attacks, heart damage, or anything like that. This structure right here is actually the mitral valve. We're sitting below the mitral valve, and we can watch that mitral valve open and close.
Absolutely amazing.
We also can calculate all the sizes of the heart, the dimensions of the heart. We can calculate how much blood the heart pumps per beat and per minute. We can calculate how much the heart weighs. This is how much the blood pumps per beat and per minute. We can calculate the efficiency of the heart, the size or the volume of the heart, and also the weight of the heart. We all do that in the 10 seconds.
So if someone had heart failure,
we'd actually see the heart enlarge, and you can measure that. And we'd also, in people who've had it, we can also measure it improving too. We can also see evidence of old heart attacks and scars. We can also cut the heart up into 20 pieces and measure the thickness of the heart muscle throughout the whole heart. Because if it's abnormally thin or thick, that gives us important information about the heart. This is showing all of those segments when they're squeezing, and this just shows all those segments are thickening normally, showing no evidence of any prior heart attack or heart damage.
Amazing.
Remember, we get 3-dimensional volumetric information about the heart, so we can also, because we have the data and we're going to look at it, we can also look inside the heart as well. So we can look at the valves. This is the aortic valve. That's one of the major valves of the heart, so we can make sure the heart valves are normal as well.
Amazing.
And what I'm going to do is we're going to look at that valve. This is the aortic valve right here. It has 3 leaflets or cusps, 1, 2, 3. I can turn that, spin that, rotate that around. So there's the aortic valve right there. This is the inside of that valve. There's the 3 leaflets or cusps. These structures right here are those coronary arteries we were looking at before, by the way. And this valve, I tell people, looks like a Mercedes-Benz sign. So that's what it looks like when it's closed.
Looks like Mickey Mouse to me.
Or Mickey Mouse, or 3-leaf clover, depends upon one's orientation. This is the cardiac Rorschach test.
All right.
We can also look at that valve when it's open, so we can make sure the valve is opening normally. There's no restrictions or narrowing. So there's the 3 leaflets, 1, 2, and 3, opening normally, so no problems with that heart valve. We also can look at the mitral valve. Now I'm slicing the heart open, and we're slicing it right through the left ventricle here. There's the aortic valve seen from below. This structure right here is the mitral valve. Up here is the left atrium.
Wait, I'm not keeping up with you. So this structure you're showing,
Right
this is
here.
the blood's moving from here to here?
So the
No,
blood,
from here to here, I mean.
blood is moving down.
Right.
This phase that we're looking at right now is when the heart is relaxing.
Okay.
So this valve, when it's contracting, so this valve is open and it's pumping the blood out of the heart.
Ah.
This valve right here is closed, so the blood doesn't go back in the reverse direction. This is the left atrium where all the blood is coming from the lungs. We also can use this to make sure that there's no holes in the heart or anything like that. Here I am taking a peek in the left atrium. We also can look at this structure here called the left atrial appendage, make sure there's no blood clot in there. That can give rise to stroke, so we can look at all that information too. Again, there's the left ventricle. I tell people don't try this at home, please. What I'm going to do now is I'm actually going to cut the heart here. I can rotate and spin around here. We're going to look at both of those valves, cut and cross section. So this is the mitral valve. We can see that from the top here.
So this is the mitral.
This is the mitral valve,
and there's
the aortic valve we looked at before.
Now that really looks like Mickey Mouse. See that? Yeah.
It is.
Yeah.
So this is the inside of the heart here. We can look at the mitral valve. This is when the heart's contracting. And then now I'm going to show you when the heart's relaxing. This valve will now be closed, and this valve will now be open as the heart fills and prepares to pump blood again. So there's the mitral valve. We can see that's opening normally, so no restriction or narrowing of that valve. We can look at that from the top and the bottom. Again, aortic valve here. This is the inside of the aorta, so this is that major 30-millimeter vessel that comes out of the heart, and that's what it looks like on the inside. That little dimple right here is actually the origin of the right coronary artery that we looked at before. So that's the origin of that vessel as it comes off the aorta. And again, there's the left ventricle and the inside of that left ventricle here. We also can go back to the heart. We can take all those blood vessels we were looking at before, the coronary arteries, and we can actually strip those out. And now what we're looking at is just the coronary tree, as we call it. So there's all the blood vessels of the heart. And here's that plaque we were looking at before. We can look on the inside. This is the inside of that plaque.
It's like a hydra from biology.
Yep. And there's the outside. And note, this stuff is growing in the outside, fortunately for him, because that's how plaque grows.
Wow.
This is a long time. This is, hopefully, I think we got it just in time, but had that plaque begun to grow any further into the blood vessel, that's when he could have had a heart attack.
And if it broke open right here and a blood clot formed, that's just all she wrote.
Right. You're going to lose all of this. See how much part of that heart, that blood vessel there supplies. That's a big heart attack, and could even be a fatal heart attack. So we do the coronary tree, yada yada, and that's what it looks like, and we can spin it around. We're going to now, lastly, we can actually take all this information, all this three-dimensional information, put it all back, because before we just pulled the heart out, now we can add everything back. So here what we're looking at is the entire scan. So there's the breastbone here.
Yep.
There's the ribs. There's the heart. We're actually looking through the left lung. I can actually put the lungs back here, and there's your left lung, or I can take that out. There's the spleen here. There's the splenic artery going to the spleen. Here's the aorta coming up out of the heart, heading down to the belly. There's the heart seen from the right side. Again, I can put the right lungs back or remove them. There's the liver right here, stomach. These vessels right here, I always like to point out, that run right behind the breastbone. There's two of them right here and right here. Those are the ones we use for bypass surgery. And as I tell my patients, of course, we're out to make sure they never need them, but if you ever did need bypass surgery, it's good to know they're standing by, ready, waiting there for you. We can look at your pectoralis muscles. There's your pecs right there. There's your pulmonary artery heading off to the lungs here. And we can also take a look at the trachea. There's your windpipe. So we can actually take a peek right down your windpipe here. So there's your windpipe or your trachea. And when we used to do this invasively, we called this a bronchoscopy to look for tumors and cancers and masses there. Now we can do it all virtually. So this is a virtual bronchoscopy, which we throw in there. And that looks good. No tumors, masses, cancers, no pennies, nickels, batteries, bubble gum. All that looks good. And then lastly, and I call this is now we've entered into the realm of stupid CT tricks. What I'm going to do now is there's the whole scan and the lungs, liver, spleen, all of that. There you are from the bottom. Stomach here, liver. There's the spine, spinal cord, aorta, and the top. Now what I'm going to do for fun is I'm going to put his shirt back on. So there's his shirt right there.
There's the buttons right there.
There you go.
All
so
right.
that's it, Scott.
Voila.
It's the virtual autopsy.
Well, so when you tell somebody that your scan is normal, you've gone through a lot of things for them, haven't you?
When it's normal, it is buck stops here, do not pass go, normal.
And if you have, so when a patient, the process for state-of-the-art cardiology is a patient comes in, they usually take some pills the night before to get their heart, make sure their heart's going nice and slow. They come in, they get the IV, they walk in, lay down, hold this, boom, 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 come back out, and then you'll either take the time to look at this
Just
and
like we
contact
did today,
them,
we
or
do
sit them
exactly the
down.
same thing. We're going to sit down with the patient right then and go through the data right now, right here, because we can actually explore them three-dimensionally with this information. And as I tell people, half of this is useful information for me. Do you have aneurysms, pulmonary embolism, things that you probably couldn't even say or spell? And information for me to guide what's going on, what the problem is, and what we need to do to take care of it. But frankly, the other half of this tool is an amazing communication tool, where I could tell you about aneurysms, pulmonary embolisms, coronary artery disease, plaque, and you go, what is this, what's it mean? But when you actually are able to point it out, and I can say, there's a baby plaque, there's atherosclerosis, what do you want to do with it? It's an incredible tool for both communication and motivation and compliance.
It worked on me. I had plaque, took my medicine. I don't have plaque. I'm still taking the medicine because I know if I stop, I'll go right back to where I was.
Right.
So why would I do that? That's nonsensical. Well, John, thank you. What a wonderful tour you've given us, and we sure appreciate the state-of-the-art cardiology tour of the body. And you have a website, correct? sothcardiology.com.
That's correct.
And people can go see and learn a little bit more about these things there.
Absolutely.
Thanks again.
All right. Thank you, Scott.